Good morning, good afternoon, good day, wherever you're coming from or joining us from. Wanted to thank you all for being here. My name is Scott Dwyer. I am one of the organizers for Power Hug, our healthcare and life sciences Power Platform user group. I do just want to let everybody know I started the recording. So we've got that going in the background here today. And we do have both our chat and our QA feature available for anybody that has questions as we go through the content. So Power Hug is a community for our Power Platform admins, makers, and users to learn from one another. This is specific to the healthcare ecosystem. So we're trying to find those patterns and those use cases and those stories that really help one another and kind of lift one another up. We're here at the fourth Thursday of every single month. Randall and I are joined by various folks from Microsoft, many customer presentations lined up through the summer. And then we'll be trying to meet in person coming up here at the conference in Las Vegas. If you are interested in being a speaker at one of our events, we would love to hear from you. Governance stories and best practices are great. Use cases are great. Even a challenge that you faced that you overcame, lessons learned, anything that you might perceive as useful for anybody else in the group. And if you haven't already, there's a few places you can find us. We've got aka.ms/powerhug. We'll take you to that same location as that QR code, whichever you prefer to use. That's our community kind of forum channel where we can send you out some messaging and reminders and stay in touch. We've also are posting our recordings on our YouTube channel at Power Platform Hug after each session. So if you want to catch up on any previous sessions, we've had some really great content. You can find them all on that YouTube page. You can also find Randall and I on LinkedIn or email us directly through the messaging on the platform or directly to our inboxes. We'd love to hear from you if you're interested, and I'll do a little bit of posting of contact information for LinkedIn pages and emails in case anybody's interested in reaching out to be a speaker. I'm going to start off here having Randall talk about just a couple of events we have coming up, and then we'll introduce our speaker for today.
Great. Thanks, Scott. All right. So upcoming events, we have next month, we have Christy from Bausch & Lomb going to talk about another use case where we're harnessing the power of AI to revolutionize medical text analysis. So she'll be walking through some of the requirements there, how they accomplished it, some of the benefits they gained, value they saw from using Power Platform and AI to analyze that medical text. And then we also have another speaker from AbbVie, Lily Ho, who's also going to be talking to us about one of her use cases. We have yet to work out that use case specifically, so more details to come. Hopefully by next month's session, we'll have that identified and available to everyone to lean in and learn from as well. And then we do have the Power Platform Community Conference in September. As Scott said, we're actually trying to organize some events there for the Hug community. So everyone that's going to attend, it'd be great to see you there. Look Scott and me up, but we'll both be there and helping drive some of those conversations, industry tables, events, and then hopefully recruiting some of you to present at the next session. We'll probably follow that conference up with another monthly session, just a recap of the event and who liked what went well, what didn't go so well at the conference, and then hopefully bring in some experts to talk about the conference as well. And then in November, we have Ignite. So hopefully we'll also be listing off some additional speakers for October and November and December in the coming months. So look forward to those. Scott, you want to move to the next? So today we're actually going to focus in on stories from the NHS. Amy Wild from the Microsoft team in the UK is here to talk us through that. And she's going to present us with various use cases, scenarios, and such that they encounter and why Power Platforms fit in so well out there. So Amy, I'm going to hand it off to you.
Great, thanks so much, Randall, and hi to everyone on the call. I think Randall mentioned my role already, but just to give it an overview, my name's Amy. I've been in the business applications team and the health team in Microsoft UK now for about actually over 4.5 years, current to 5 years, which is crazy. Time has very much flown by. And we have done a lot of work using Power Platform within our healthcare system, which is the NHS. So we thought it would be a really good opportunity to kind of share all the work we've done today and also looking forward in terms of the kind of projects that will be coming up. Prior to working within the Microsoft Health team, I also worked in healthcare myself. I worked at British Heart Foundation, which is one of the largest cardiovascular research organisations, both in the UK but also globally. And I worked very closely with clinicians and patients in that role. So it was a natural evolution to kind of come into another role where I was working very closely alongside patients and healthcare professionals. And I'm just going to go and grab my slides to pop them up. They should come up in 2 seconds. Fab. Can I just get a few like emojis or thumbs up to make sure everyone can see those? Fab. Thanks, Scott. Great. So yeah, so what I really wanted to speak about today is stories from the front line. So how low code and automation technologies which leverage the Power Platform are being used within the NHS. In terms of the presentation style, I'm really, really keen for people to, either ask questions or raise your hand or pop them in the chat for Randall and Scott to collect. I'm very happy to kind of answer things as we go along, but we'll also have a little bit of a Q&A session at the end also. Before we get into actually looking at some of the use cases of how this technology is used in the specific healthcare system, I wanted to do a little bit of an overview of the NHS. One of the reasons for this is when I first joined Microsoft, I had the opportunity to come over to Seattle to meet lots of other people working within the Power Platform space, which is really exciting. However, what it taught me is in the UK, the NHS is kind of such a source of pride as our national healthcare system that we assume everyone in the world knows about it, and that's not always the case. So I just wanted to give a little bit of an overview of what the NHS actually is, some of the principles that it's founded on, and some of the terms that I might refer to throughout the presentation, just so you have an awareness of what those terms mean. So first thing I thought was really interesting when I was just thinking about, how do I capture what the NHS is? So the NHS is the UK's national healthcare system. That's where the abbreviation NHS comes from. As well as the name of the system also been abbreviated, the NHS seems to love an acronym. So if I do talk in acronyms at any point during today's presentation, please call me out on it, or please, ask me to clarify in the chat, because we do tend to use them a lot as shorthand. But one thing that's really interesting, if you look at a lot of polls or research organisations, consistently the NHS is considered a really great source of national pride in the UK, which comes above the Royal Family or the BBC, which is one of our main broadcasting channels. And I think the reason this is really some of the principles that underpin the NHS. So essentially, the NHS provides health and social care to all UK citizens from cradle to the grave. So what we mean by that is throughout the whole of your life, and it's free at the point of care. It's able to do that because it's funded by taxation, which is collected in a number of different ways throughout the UK. And it's really funded on this belief that healthcare is a fundamental, universal human right that everyone should have, regardless of their social or economic background. And I think those principles are something we're really, really proud of in the UK. People are very proud of the NHS and what it's been able to do. On a personal level, my own experience is that the NHS has saved my life and the lives of multiple family members. So I feel really passionately about working with it as a healthcare system. And before we talk about the use of Power Platform within the NHS, again, there's two kind of key terms, or I wanted to talk about a little bit about how it's actually structured as a system. So first of all, I might end up saying NHSE in the presentation, and that refers to NHS England. So NHS England is actually a government organisation. It might be a bit like in the US, the Department of Health, and it has responsible for funding all NHS organisations in the UK and also setting health policy. At the same time, whilst we do have some national direction happening from central government, you have kind of federal and state law in the US. It's actually a devolved network, the NHS system, and it's comprised of something that we call NHS trusts. Now, the best way to think about an NHS trust is it is essentially the organisation that manages healthcare at a regional or local level. So an NHS trust might have multiple hospitals or multiple primary care organisations under its control. And that is how it's organised as a system. Now, one of the things I wanted to talk about here was actually how one of the reasons why it's so important, why I think it could be really important to look to the NHS and its use of low code, is because we've seen the use of Power Platform really proliferate throughout the network in probably the last 4 years. We saw a really rapid increase in the use of Power Platform during COVID. Most of the NHS use Power Platform in some element to support their emergency response to the pandemic. And that might have been things through using Power Platform to manage vaccine management of the COVID-19 vaccine. It also helped with recording lateral flow test results to know whether staff or patients had COVID-19. And it also was used to do things like sit reps, so situational reports about how many patients in a trust had COVID, how many beds were available, how busy was an ICU in terms of the intensive care unit, etc. And since then, what we've seen is the NHS has really taken on board Power Platform as a technology that can be used to really support healthcare providers. Just on this slide, really, and again, this is kind of tip of the iceberg in terms of NHS organisations that are using Power Platform, but I just wanted to touch on a few of them and talk about how they're using it. So in the middle, we've got some of our more central organisations. So the CQC, which is the Care Quality Commission, they are the regulatory body for the whole of the NHS in the UK. And their role is really to make sure that any NHS organisation or hospital is providing really high levels of quality care. Now, they actually use Power Platform to manage their hospital inspections. This happened really quickly. We did a series of discovery workshops with CQC in 2020. And they essentially started to use Power Platform to make their hospital inspection process more efficient and also more digitally managed, so it could be managed in more of a socially distanced manner during the pandemic. We've also got NHS Wales and NHS Scotland here. So these are national organisations that form part of the NHS but outside of England. Both NHS Wales and NHS Scotland have a national premium Power Platform technologies, and they're using it for a host of different use cases, which we'll get into. And then kind of all these other logos that are peppered on the screen just speak to some of the NHS trusts that are using Power Platform. Some of these might be acute trusts, so using it in hospital settings. Some are mental health organisations, and some are community care, so actually using Power Platform out in the community as well as within, internal healthcare provider settings. And what's brilliant, actually, that's one of the things that has really taken off recently, and it's something that we think could be of use and over time might have more of an external focus, is something called, we either refer to it as the NHS Solution Store or the NHS Mail Solution Store. So what this is, if you can see on the screen, is we've created with NHS England. So just to go back to that, NHS England is kind of that central body which sets policy and direction for the NHS as a healthcare system, as a healthcare provider. This is a central app repository. So it's a way of collecting and documenting all of the Power App solutions that we've actually gone live with in the NHS to date. And what it means is if you're a NHS healthcare provider, rather than building another app from scratch, you can go into this central repository and see if the use case already exists. I was actually talking to Scott and Randall today about this, but before today's call. As healthcare systems, what we tend to find is whilst each healthcare system is different and will have some changes in the challenges, there is a lot of common challenges that exist in all healthcare systems. So one's in the UK, one's in Europe, one's in the US. One of these might be clinical supervisions. How do you make sure you're managing your supervisions of patients well, that you're recording all of the information, that you've got all the engagement data, that you're doing the time and date stamp for those really important kind of moments with patients. It might be about vaccinating staff. That's always been important for healthcare systems in terms of managing winter pressures and doing things like the flu jab. But following the emergence of COVID, most healthcare systems will have a mandate in place now to ensure that the majority of their staff also are vaccinated against COVID-19. So those are just a few examples, and there's more on the screen. But this has become a brilliant central repository, and there's about 30 solutions live on that store now, and I think we've got a backlog, I think, of like 80. And there's actually only 2 individuals who manage the store at the moment, so as you can imagine, that's a really big job. And we're constantly kind of each week trying to add more onto there. If you think this could be really useful, even if you exist, outside of the NHS, or you're working for a different healthcare system or provider, please let me, Scott, or Randall know, either in the chat or following today's call, because the NHS is really, they're a very collaborative organisation. And going back to those principles that we spoke about at the start of the call, people who are in NHS leadership, they really do believe that access to good healthcare is a fundamental right for all. And therefore, if they've got any digital tools that can help improve access to patient care or improve patient outcomes, they're very, very willing to share it. And that's one of the reasons I love working with the NHS and feel so passionately about my role. So we can definitely give you some kind of access to some of the app templates on there. And the other thing is just to speak about the need or the utility of these solutions. This only really went live towards the end of last year, and there's already 7,000 monthly active users in the NHS, and that figure's about 3 months old. So I think if I checked in with the team now, it's probably growing to over 10,000 active users. So I think that really illustrates that these apps have like great use within healthcare provider scenarios, basically. Scott, Randall, are there anything particular in the chat that I should be picking up on for now, or keep going?
You're good to keep rolling.
Fab. Now I just wanted to take a bit of a deep dive into some of the someone says the Q&A is not working. We might want to take a quick look at that. I wanted to take a bit of a deep dive into actually some of the apps that we've got in use in terms of within the NHS. And one of the ones I wanted to talk about is clinical observations. So when I work with healthcare providers, including the NHS, we tend to find that the Power Platform can provide great value in 3 areas. So any healthcare provider will tend to have 3 key functions. They'll have clinical functions, people and HR functions, and finance functions. And we'll kind of go through each of those on today's call. But the first one I wanted to talk about is focus on some of those kind of clinical apps and how they're used. So one of the challenges that a lot of NHS trusts have faced is actually the management of clinical observations. This is something that as a healthcare provider, you can normally do some things within your EPR, so your electronic patient record. But what we've tended to find is that most EPRs are designed, as with most really big systems, it's a bit of an 80-20 principle, right? They work really well for 80% of the patient pathways you're managing, and they work really well as a clinical record of truth, but they work less well as an engagement record of truth. So actually, what level of patient engagement have you had? And sometimes what we found is clinical observations fits into that engagement side of patient management as opposed to the clinical side. So your EPR might allow you to record some information about a patient observation, but what it might not do is make it really, really easy for your clinicians to manage observations and also prioritize their workload. So what we've done is actually built out a clinical observations app. There's some screenshots of it here on this slide. And what it essentially means is that any clinician can log into the app. They'll be able to see, only based on their kind of security privileges, patients on their ward or patients that they're supporting, and not the details of other patients. And they can create a new observation wherever they are. So this is brilliant if you are working in a healthcare provider where your EPR maybe is only available on certain desktop computers, but you're at another site and you want to be able to do this in a mobile way. Or it's even that there's some kind of healthcare at home model where you've got patients who are managing their healthcare in their homes, in the community, but you still have a responsibility as either a primary care physician or as a community nurse to do some level of observation with that patient. And as you can see here, the impact this has had from an administrative perspective has been huge. So one of the trusts we've worked with, they've had the time drop by 86%. So the time it takes to actually do an observation is much quicker, but compared to last time, or like prior to the use of this technology, where they were sometimes doing it paper-based and then having to take it back and do a duplicate entry into their EPR. And also another thing that's really impactful is that when this trust went to look and have this build done externally, it essentially ran into the hundreds of thousands. So being able to build this solution out on Power Platform was an 80% reduction in the cost they were expecting to build this app, which is really, really important for improving clinical experience, the clinician's experience, and also obviously for managing patient safety and patient outcomes. And another thing that's really key to flag is that if we all remember that healthcare is an incredibly regulated industry for many obvious reasons, and the main one being protecting patient safety and patient health. In the UK, there have been a few incidences where it was found that clinicians who were very, very time poor and maxed out in terms of the amount of patients they were supporting had actually falsified some of their clinical observations. Now, I don't think that was from any point of malice. I think that was often that people were doing multiple observations at one time, writing some things down on paper, and then having to take that back to another, a desktop computer to input that information, and they were inputting it incorrectly. Whereas in this new model, clinicians can do it really easily in the moment, and that information is stored then back into your EPR. So really transformed the experience of the clinicians, whilst also maintaining patient safety and ensuring that as a healthcare provider, you're meeting regulatory standards really, really well. The second thing that I just really love about the app, and this was some of the feedback that we got from clinicians using it, both doctors and nurses, is kind of this prioritization. Previously, a clinician would just go in to look at what obs they've got to do on a shift, to just get a really, really long list. You might have 30 patients. You've got to delve through all of that information to see when that patient was last observed and work out mentally. So it's quite a big mental load about which order you should be doing patient observations in. With this app, you have full visibility of when the check is needed, right? So as you can see here, Anita, her last observation took place 60 minutes ago, and therefore she's due her next observation. So it's at the top of your screen, and both because it's at the top and because of the use of that red coding, that you need to go and see that patient immediately. Whereas for the next Anita on the list and the next patient, it's in green because they have recently had an observation by another healthcare professional and you've got a little bit of time. So I think this is just a really beautiful example of how Power Platform can make life a lot easier in clinical scenarios for the clinician, and that can have a downstream impact on patient outcomes and patient safety. So just wanted to share that insight.
Hey, Amy.
Yeah, go for it.
We actually have a couple questions if we can interject.
Go for it. Do you want to read those out to me? And I'm happy to take them. So
the first one we have from Jim Novak, do you have any flavors of apps that are in high demand?
Yes, definitely. Great question. So I think in terms of the high demand piece, I think really just go back and we'll come on to it a little bit more in the presentation. But we tend to see this kind of segmenting of clinical apps in workforce management of healthcare staff, and then also using Power Platform to extend finance operations. When I think about the most high demand apps that we see in the NHS, probably if I had to put it in two kind of types, one is in this clinical setting where you are doing anything that is going to improve patient outcomes or patient safety, and there's some tie to healthcare regulation. So things like the clinical observation app have been really big. but then also apps that allow you to do auditing. So it might be auditing of a ward, it might be auditing of quality of care, it might be auditing medical equipment. So anything to do with patient safety has been really powerful. And I think there's two reasons for that. One, you can build things out very quickly. So if a healthcare provider identifies an issue around patient safety, you can build something out really quickly to address that. So I can speak to an example. We were working with a mental health trust, and really sadly, in a 12-month period, they'd had quite a few number of suicides in their inpatient wards. And as a result of the investigations into those suicides, it was identified that there were ligature risks, i.e. there were things or objects within the patient's room that had been used within the suicide attempts or the actual suicides, which could have been picked up by clinicians or the facilities management. And in some scenarios they had, but it hadn't been communicated very quickly to facilities, and therefore those ligature risk hasn't been removed. So we built out a ligature risk app, which meant that if you're a clinician, you saw something in a patient setting that could be a ligature risk, you take a photo, you write a quick description, you say where it is, and that will immediately notify estates and facilities management within that healthcare provider, so they can come and really quickly address that. So those kind of apps are really, really in high demand. And then the second area is really about workforce management, which we'll come on to. So we tend to find the management, again, I think this is a problem that goes across all healthcare scenarios, right? Like, it's well understood at the moment that every healthcare system has a huge gap in terms of workforce, its clinical workforce. And therefore, anything you can do with Power Platform to make onboarding clinical staff easier, to make their experience easier, to make things like shift management more effective, to ensure they're getting paid correct or they're being moved onto the right rotation if there's something like a junior doctor, is extremely powerful. And it's something that has a really big impact on you if you're a frontline clinician, but is also really, really important to the management of healthcare providers. So yeah, at a very high level, those are kind of two areas where we see the highest type of demand. And I'll come on to some more examples of that throughout the presentation. I hope that was helpful.
Great. So I think we have another question here from Matt Williams. Given the communal nature of the store, what vetting is performed on apps that are shared there, both from a security and a compliance viewpoint? And then further, while there may not necessarily be malicious intent, injudicious use of code or data could pose a threat to an organization's data.
Yeah, great question. Hi, Matt. So it's a great question. It's something we're constantly evolving. We at one point looked at Microsoft doing some kind of checks on that. The issue is that we can't necessarily do that because we could be potentially seen as liable when it's not actually our apps from a legal standpoint. It's the NHS trust apps. So at the moment, there is some very light level peer review done before something goes on to the App Store. But we're working with NHS England colleagues to actually help make that process more robust. So we actually have some of the engineers from Power Platform currently working with NHS England. Some people on the call will be familiar with PowerCat. It might be useful, Scott or Randall, if we can pop a link in around that. But PowerCat stands for Power Customer Adoption Team, and it is run by engineers of the Power Platform. And essentially their role is to help improve the adoption and security of Power Platform solutions within customers using it. So they're working really closely with the NHS England Solution Store team to create a more robust process for checks and balances. But I think even if that's in a really robust place, there should always be a responsibility on the local organisation to do some kind of code check. In the same way, if you worked with a Microsoft partner and they delivered a good app, you would still probably do some level of testing internally, right? Like, that is just good practice in terms of, app lifecycle management and the management of digital solutions. So yeah, we're trying to make it a bit more of a robust process, but I think there'll always be responsibility locally to check that, right, in the same way that there would be with any kind of digital solution used in healthcare. Fab. Are there any more, Randall or Scott, or shall I keep going for now?
Feel free to keep going.
Fab, thank you. This next app I want to talk about is a pressure check concept. This is kind of the initial drawing, sketch out, and then I'll show you what it looks like live. But I wanted to share the story behind this because I thought it was really interesting. So when I work with NHS trusts, and I've probably worked now individually with probably over 70 healthcare providers within the UK and Europe in terms of supporting them with the use of Power Platform. But when we see NHS organisations or healthcare providers start to look at this technology, they often get really excited, they can see many use cases, etc. But the challenge is often, as you would see in any organisation, that business case right and getting sign off from your management. So whether that's you've got to take it to board, or you've got to take it to your CFO, or you've got to take it to your CIO, you normally have to go and take the investment off to be signed off, right? And what I tend to see within healthcare providers is there's two main drivers of the investment. There's what I would say is the most rational one, which is when we have a long list of challenges within a healthcare settings, and we can show really rationally how Power Platform can support those. And then there's the more emotional hearts and minds piece, where there is something that is causing a big headache for your management in a healthcare provider setting. So maybe they've been in the news loads recently in the media because there's been an issue with patient safety, or there's been some kind of issue with workforce bullying or really high levels of stress and burnout in your clinical staff. And in those scenarios, if you're able to show how Power Platform can very quickly meet that headache for your management team, the investment tends to go much more quickly. So whenever I work with a healthcare provider, we try and identify both of those. We identify the long tail of kind of rational solutions where we can help address key challenges, but we also try and find this kind of almost Trojan horse, right? What is something that's really emotional and that needs to be addressed right now that Power Platform can solve? And this is how the pressure check concept came into being. So I was working with the digital team at an organisation called North London Mental Health Partnership. And we had the long list, right? We had the long list ready to go. But I said to one of the digital directors we were working with, if there was a problem that we could solve for your hospital board, so the whole management team yesterday, what would it be? So don't think about technology, just think, what would it be? And he said, oh, well, if our senior leadership team could have something in their pocket which showed them patient flow, and where there was challenges with patient flow in the organisation, they'd bite your hand off. And I said, we can do that. We can do that in Power Platform. And so what we built out here is essentially exactly that. It's a pressure check app, which means all of the senior leadership can go onto it and they can see where is their demand coming from in terms of inpatients, where is their capacity in different wards, how many discharges have they done in the last 24 hours, where are they not really having discharges, and then they can look in and look at the challenges. And what that means is they constantly have this live view, right? And then they can go and speak to those specific teams to say, hey, we can see in older adults, we've had no discharges for the last 24 hours. What's the hold up? What can we do to empower you? Oh, well, we haven't been able to get any patient transport, or none of the local care homes can take any older adults right now. And it immediately means that the management can much more quickly speak to those kind of, see those challenges and see how they can support their teams. So I just wanted to flag that because, again, when we think of endemic issues or knotty challenges within healthcare, I'm yet to work with a healthcare system globally that hasn't got some issues with patient flow in inpatient settings, or issues with discharge planning, or the discharge experience. So I just wanted to flag that as well. And this is what it actually looks like now with kind of live in app form. Next thing I want to talk about was, again, I told you we love an acronym here in the UK and within the NHS. So PERSIF stands for Patient Safety Incident. I always forget the R. I think it's Reference Framework, but essentially it's a policy that came in nationally from NHS England, and it's about how do healthcare providers better manage patient safety and reporting incidents when they happen. So another way to think about this is that it's an incident management app, right? So again, any healthcare provider globally will need to report serious incidents. So they've got that visibility from an audit perspective, but also so you have a catalogue from which you can learn and make sure those kind of risks don't happen to patients moving forward. We were able to build this out, I think, in less than 2 months and go live with it within this acute NHS trust, and the feedback has been brilliant. Previously, they were doing this on a kind of combination of Excel, email, Teams, very hard to collate all the information, and now it's all in one place, and it's had a really positive impact on patient safety at the organisation. So again, if you are working in a healthcare provider or working with healthcare providers, another area is, how are you managing your serious incidences? How do you look at incident management reporting? Do you think your clinicians are really telling you about all incidents? Because actually, is it really difficult to report an incident? In some scenarios, it's taking clinicians over 90 minutes to report something. And if you're already a really time poor clinician, are you going to get to that when you've got 20 live patients to see? Maybe not. Whereas if you can make it 10 minutes to report an incident, it's much more likely that you're going to have much more high quality data about what's really happening with patients and their safety in your healthcare provider. So again, these are just a few screenshots from what that looks like. Carrying on from that theme about what I was talking about in terms of audit management, just really 2 cool use cases that I wanted to flag. One is London's air ambulance. So what we mean by an air ambulance is in really urgent healthcare scenarios. So often when there's been a really big trauma, something like a car crash, or a big public incident, a usual ambulance might not be able to get there quick enough, and we have air ambulances, which are essentially helicopters that go out as a first response with paramedics and doctors in. And they are using Power Platform to manage all of their medical equipment to ensure it's charged correctly, it's up to date, the medicines they have in the air ambulance are correct, and they've got enough supplies. And this has been transformative for the air ambulance teams. Previously, they did this via a whiteboard in their central HQ. As you can imagine, that left a lot of room for human error, and meant that there were certain scenarios in emergency situations where they didn't have everything they needed from a critical care perspective. So this has had a huge positive impact, and it's led to them using a lot more power apps basically within the air ambulance. Taking that on even further and thinking about actually how do we start to use some of the AI capabilities within the platform. I just really love this example, again, for saving clinicians time. This is another way of looking at your medical equipment or your medical supplies. And essentially, it's a way of either using AI Builder to either scan something like a medical equipment box or a storeroom, and it can quickly identify what is missing and actually make recommendations about what you need to get your storeroom up to date. Now, that's brilliant because that then means in certain scenarios, you don't always need a senior clinician doing those checks, right? You could have someone like a healthcare assistant or a more junior member of your team using the AI Builder and being able to make initial recommendations based off that. So again, huge time saving, and it means that clinical resource can be used more effectively within inpatient settings. Randall, I've just seen you've come on camera and there might have been a question.
We've got a few questions, so
go for
lots
it.
of interest. So first, this one's going to be around the use of data primarily, but it's many parts, so answer what you can here, and then we've got a few others from other participants as well. So first, Amy, can you speak, and this is from Colin Underwood, can you speak to data and governance? Was a COE important to the NHS before adoption of Power Platform? How is data governed? How did the NHS triage solutions to take forward? And then is citizen development encouraged to improve productivity?
Great questions. And actually, I'll be really transparent. I didn't put much about governance in my presentation today. The only reason being, this sounds like a bit of an oxymoron. It's so important. It needs its own session, right? To really go into the details of Centre of Excellence, how you set up your apps, how you make sure the right people have access, especially in clinical scenarios where you're going to have access to sensitive private patient data, right? Like, it's really, really important. So yes, governance is incredibly important. And I am actually just going to, it's a great reminder to post something. I'm just going to pop in the chat. So it's of huge importance, and just in the way that there is a central repository for apps, we are trying to work on creating a central repository for governance and documenting how to use a Power Platform and best practices of a data management perspective in clinical scenarios. What I've just sent a link to is a link to a small kind of mini public site by Berkshire Healthcare. They're one of the NHS trusts that are using, or the healthcare providers in the UK that are using Power Platform the most extensively. And what they've published on that site is not only use cases of how they're using Power Platform automation, but also information about the data standards they've met using Power Platform technologies, how they've done that, and also how you make sure there is assurance that Power App solutions meet the clinical data guidelines that we have that are mandatory throughout the NHS. So going back to that point of regulation, within the NHS, quite rightly so, there is a lot of kind of standards, clinical data standards that have to be met for any digital solution that is live in a trust, and even more so if it is connecting into clinical systems such as your electronic patient record. So I'd go and have a look at that. Our idea is to build on the work they've already done and start to have kind of templates around that and kind of recommended policy and guidance. So again, it's kind of build once, use it many times, as opposed to every single healthcare provider trying to build out their own policy. And again, I think this is something that can happen in other geographies throughout the world, right? Like actually create that collaboration so everyone's moving at a quicker pace to make sure you've got that right level of data quality and security. I won't go into it in too much depth because, as I said, we could be on it forever, but I hope that's useful. And then the second point, so in terms of citizen development, it's really interesting, but for me personally, I don't want to say discourage because that sounds too negative, but in healthcare scenarios, we see the use of Power Platform be the most effective when you're extending and enhancing the capability of your central digital teams and your junior digital staff. The reason being is pretty much every clinician we speak to is already extremely time poor. So the idea of me saying to an NHS doctor or an NHS nurse, on top of all the other challenges they have, I also now am telling you, you need to build out the apps to address those challenges. It's not feasible. And the only way that we found that clinical staff are doing that at the NHS at the moment is they're doing that in their weekends, in their evenings, on their days off. And given that this workforce is already incredibly stretched, I don't think that's fair. So what we have seen is that it's much better as an extension of your digital teams, as opposed to, you're pushing it onto all of your kind of frontline staff to build apps. That's not to say that a fusion model doesn't work really well. So a fusion model is where you will make sure you always have representation from like your patients, your nurses, your doctors, your physicians, because they're ultimately the end users of this technology. And their role there is to feed in their insights and their experience, but it's that rather than doing loads on the build. And if you want a great example of how that's worked really well, have a look at the use case by Oslo Agency for Health. We'll pop it in the chat window in a bit, but they are a very mature healthcare system based in Norway, and they do all of their development of Power Platform solutions through a fusion model rather than a citizen dev model, and it's worked extremely well. And I think the other point is, again, with the citizen dev piece, that works quite well in non-highly regulated industries where maybe you don't have as much sensitive data, but you don't necessarily want citizen devs working with patient data, right? Because inherently there's a little bit more risk there. So yeah, that would be my take. It's more about extending digital capability rather than getting your clinical staff building things out.
And I think maybe with the link that you shared there might help answer this next one from Jim. And he's asking, how many of these apps share a common data source? Are they connected to the EHR, Dataverse, SQL? Is there a common source that they typically connect to?
Yeah, great question. So it's very dependent, and we kind of tend to see a trajectory. So yes, most of the clinical ones, we will connect into the EPR, and we actually won't even use Dataverse or something else, right? It will just be a direct connection into the EPR. That is for a number of reasons. It's good to have one central source of the truth and one place to store your data. Second, it makes data management a lot easier when teams are taking this to their governance teams or their IG teams, to be able to say it's just going to be stored directly into the EPR is a much easier message to deliver from a security perspective than we're also introducing another database for patient data. So predominantly with clinical ones, yes, connects into the EPRs. Within the in terms of connectors, yes, they are all custom at the moment. I think it would be very, very surprising that if we don't see in the next year certain connectors become standardized, right? So the likes of, and things like Epic or Cerner, these really big EPR providers, I'm sure we'll start to have some of the custom connectors which healthcare providers are using put into the standard library of connectors, because there's such a big market of healthcare providers that could benefit from that. Equally in the UK, we have a lot of sharing of custom connectors for EPRs that are used just in the UK. So whilst they aren't standard in that they sit on the Microsoft.com site, they've become standard in that they're shared so kind of frequently between healthcare providers in the UK. And then in terms of, when I said trajectory, what we tend to find is a lot of healthcare providers they're using SQL, right? They've got SQL databases, they're used to using SQL, their teams are competent on using it. So often we will connect into SQL in our first versions of building out Power Apps. And then usually over a period of like 6 to 12 months, we're doing the education on Dataverse and the benefits of that as a low code database. And then we start to see healthcare providers move some of that Azure SQL state, estate onto Dataverse.
All right. So the one other questions, and this is from Michael. Was there a tutorial or set of documents that NHS used to help set up Power Apps and the complete integrations with the different data sources?
Great question. So I would say yes and no. We've been really fortunate within the UK that we've got quite a small network of really, really capable partners who either work solely with healthcare organizations, or at least 50 to 60% of the customers I work with are healthcare organizations. So they've done a lot of the education from that perspective. I think I just saw Cassidy add something into the chat as well from the support site, so thank you so much. There has also been national training, so we've run it through NHS England. I can probably get some of the video recordings and things like that, and then we've also done the likes of App in a Day or similar kind of workshops where we talk through that tooling. One thing that is in motion at the moment is we are trying to create a set of training, which is taking standard Power Platform training, but customize it specifically for healthcare scenarios, basically. And once we have that live, again, I can't see why we can't share that outside the NHS, right? If it's beneficial to other healthcare providers, we should definitely be sharing it. So I can take that as an action to get that shared via the Power Hug forum as well.
Great. I know we're coming up on time, Amy, so feel free to jump to your next topics and we'll wrap up here in a few minutes.
Fab, yeah. So I'm just going to whistle through, but this has been on the screen for a while now, but you'll remember a little bit ago I said basically workforce management is a really big area for Power Platform and healthcare providers, and I think this slide does a brilliant job of encapsulating that. So this is a trust where essentially Power Platform has become the top layer, and it's the way that all employees interact with any people needs or HR needs they have. So whether that's onboarding, whether that's for their learning, whether that's for doing their appraisals, whether it's for them being supervised to make sure they're acting, to the right level of clinical capability. Maybe they're changing circumstances, maybe they're taking staff leave, maybe they're leaving the organisation. We've seen a huge use of tools using Power Platform for workforce management, and it has a huge impact within healthcare providers. It will not take you long to go and do a quick Google and look at morale levels for healthcare staff. And on the whole, whilst, people feel they've got a great sense of purpose, morale is low. They're often not paid that well, their hours are long, they deal with very, very emotionally demanding situations. And therefore, anything we can do to improve the experience for healthcare workforces is really positive. And so we've got a whole repository of apps. So if you've got any kind of people and HR challenges, please do reach out to me, because without sounding too cliche, there probably is an app for that. And it's the areas where we've seen the biggest impact. As well as having an impact, for the clinicians, there's huge cost savings, right? And there's huge things like talent savings. So we've been able to make the time from going from an application, a job posting to someone being enrolled a matter of weeks rather than months in certain healthcare providers. And not only has that meant they can meet their workforce challenges much more quickly, it's also really prevented them from missing out on qualified candidates. Previously, one of the healthcare providers we were working with was they were interviewing really qualified staff, they were offering them the role, and then it was taking them so long to get a contract out and a start date sorted that in that time, those candidates moved to other healthcare providers, because it's an incredibly competitive industry. So we can really, really help healthcare providers stand out when they're trying to attract talent by using Power Platform. And then there's other cost savings. So for example, with the Levers app, we've worked with a lot of healthcare providers where they have been paying senior clinicians for 6 months, 12 months, 2 years after they've left, just because there was a lack of connectivity between the HR systems and payroll. Senior clinicians are on a lot of money, right? And it doesn't take that many of them to that very quickly be quite a large amount of money for a healthcare provider to be losing. So yeah, we can have a huge impact in this space. I'm just gonna pop through. And very similarly, we can do the same in finance. So we can really wrap around kind of core finance systems and do a lot of that kind of make things a lot easier if you're someone who maybe you don't need to be in your finance system every day, but you need to get really key information out of it, and that might be currently really hard. Power Platform can make it much easier to get key information out of your finance system and for it to be done in a much more straightforward way. And all of the use cases here are live within healthcare providers within a finance setting. And then I'm going to skip the demo just for time, but kind of two key things I want to make a point on. This is timeline of a NHS organisation we're working with in terms of implementing apps. And one of the things that I think is amazing about Power Platform in health, not only is building out an app very quickly, a huge benefit, but if you create an app that can essentially be used in many different healthcare providers, your implementation timeline goes down from maybe a month or 6 weeks to a week. And this is what this is showing, right? Like pre-existing, you can get apps out really, really quickly. So you go and speak to a trust, they have issues with vaccine management, they've got issues with primary to secondary care referrals, they're not onboarding staff very well, etc. You have all of these apps ready to go, which means the speed at which you can get these live in a healthcare setting is phenomenal, and it's really, really beneficial. And I don't think there's another kind of vendor or technology type that can do that within healthcare. So I just wanted to flag that because I think that's really, really exciting about the technology and incredibly impactful to healthcare providers. We'll share the slides afterwards, but again, this is showing just the demand plan of Power Platform solutions in one of the UK's largest healthcare providers. Probably about 35 use cases of Power Platform on here. So I would hope one thing you take away from today's call is if someone says, oh, I don't think we've got any use cases for Power Platform, and they're a healthcare provider, I want you to feel confident saying, not you're wrong, but like let's interrogate at that, because I'm yet to work with one healthcare provider that doesn't have multiple challenges that can be addressed by the technology. So I really hope that message has got through. These are some examples of automation, but I will leave these in the deck to go through. And I'm going to whistle stop through this. And then this I just wanted to talk about is, again, one of the reasons the platform is so amazing is there's not really another technology that has the same level of capability that can respond so quickly to changing demands. And I know there's obviously the cliche of the only thing that's constant is change. That couldn't be more true of an industry than healthcare, right? Whether it's a global pandemic, new policy, aging population, different patient demands, there's always a new requirement. And I really think it's only really Power Platform that is placed to respond to that really quickly. And just two recent examples. So One is around bed management. You can read that bit yourself, but it's a huge issue within most healthcare systems. We're working on an app to address that within the NHS. And then secondly, there is something called Martha's Rule that has recently been born into NHS policy, which essentially is a change which means that the friends and family of a patient can ask for an urgent second medical opinion rather than it only being healthcare professionals who can ask for that. Brilliant policy, really needed. Many healthcare providers in the NHS don't have a way of recording the how the Martha's Rule is used within the trust, any learnings they get from that, any of the information they need to provide back to central organisations such as Public Health England and NHS England. So we're now working with a few trusts to build out an app that would allow them to do that. And again, I think that just shows how well you can respond really quickly with the platform. And then finally, this is just a little overview of some of the most kind of common use cases of the technology throughout the NHS. But as I said, kind of high level, by no way an exhaustive list, and there's many, many more. And then finally, these are some of the resources that we will share following today's call. But thank you so much. I feel like that was a whistle-stop tour, and it went so quickly. But yeah, hopefully it gave a little bit of insight about what we're doing in the UK using low code in healthcare settings. And hopefully it also got across how passionate I feel about this and that I'm really, really keen to support anyone who's doing work in this space.
Thank you so much, Amy. I'm just taking over the screen share. We really appreciate your time. Randall and I had talked before the call that there might be a part 2 in order, and I think we might have to bring you back here next fall sometime. Don't forget, we're here the 4th Thursday of every month. If you're going to be at that Power Platform Conference next September, please reach out to Randall and I. We'd love to connect with you in person. We'll have a couple of roundtable events, networking events while we're there that we're hosting. Want to make sure you're aware of those and get in touch with us. Next month, again, we've got Bosch and Lamb talking through some use cases. And we'll have this recording up on YouTube after the fact, and join us on the community if you're not already there. Thanks, everybody, for taking some time today. We'll see you next month.
Thanks all, and yeah, feel free to reach out to me if you've got any questions following today.
Bye, everyone.